Hey everyone, my name is Victor Pacific Rwandarwacha. I'm the Chief Executive Officer of Devie Health Innovators. Devie Health Innovators is a social enterprise working in Rwanda to address health challenges through innovative ideas. It was founded by a multidisciplinary team of young public health enthusiasts in 2019. We serve our community by promoting innovations on self-care for health in the health system through generation of health data, health education, and behavior change. We aim for accessibility of health information for all, leaving no one behind. Devie Health Innovators intend to develop projects with a lasting socio-economic impact. Our vision as Devie is a society that understands and practices self-care for health at all levels of health system, leaving no one behind. Our main mission is to promote community-centered innovation for the most pressing health challenges through generation of data, health education, materials, social and behavior change. We mainly work on provision of trainings, participating in health research, health information, and producing health education materials. Through Core Group, Devie won the first ever Peace Challenge during Global Health Practitioner Conference in 2019 to implement our initiative of preventing teenage pregnancy through production of comic books and videos. To develop our health education materials, we used a Pathway to Change. Pathway to Change is a game that is designed to make problem of behavior change more understandable to community health workers and peer educators. When this game is used in the community, it also stimulates thinking that can motivate individuals and the community to change. In other words, the Pathway to Change game has two main functions. First one, when members of the target population play Pathway to Change, they can better understand risky behaviors, how it can be avoided. In this case, it is a teaching tool for community members. Secondly, playing Pathway to Change can help community health workers and peer educators understand the target population perceptions of barriers to change and the facilitators of change. When the game is used in this way, it's like an informal tool for collecting data. In this sense, it's a running tool for community health workers and peer educators. One example that were used for making one of our materials is where we have the case of Keza, who is 16 years old, who lives in a rural area with their parents. Then one morning, when Keza was rushing to go to school, her parents found a condom in her bag, and it was a mistress in the family, and everyone was condemning her, calling her a whore. Then our objective was to insist on the role of parents on sexual education. When we were conducting this Pathway to Change, we did this to both teams, team of youth and team of parents. Then we had to correct their ideas on how they think about the behavior of parents, children discussion about sexual education. So when we were conducting Pathway to Change, we selected teams, and each team were having 6 people. And every person had to pick a number. So from 1 to 6, everyone had a number. Then you had to assign them as barriers, facilitators, considering the levels of influence, including at the personal level, environmental level, and also the family level. So we did this using the Pathway to Change chart that we are going to be explaining shortly. As you can see, this is a Pathway to Change chart. This is the tool that the moderator of the Pathway to Change game use while conducting this game. As you can see, there is a start and there is a finish. So after the moderator has assigned the papers and numbers to the participant, he has to pick randomly the one who has to start. So this number that we can see in the chart, it has B. B stands for barriers. It has F. F stands for facilitators. It has S stands for social. P stands for personal. and E stand for environmental. So meaning, for example, for B and S means social barriers, for F and P means personal facilitators. Here for facilitators, we want to know what are the factors that can influence the change of the behavior. And for the barriers, we are seeing the challenges that are hindering us to reach our behavior change. So when we pick the first person to start, he tells you his number or her number. For example, if the first participant choose number 4, so he has the choice to choose whether he will take this line or this other line. So if we pick, for example, this line, we count from here, then 1, 2, 3, 4. So meaning he will be responding about social facilitators, meaning according to the topic that they were provided, he will provide the facilitators that are social influencing the behavior change. So meaning that's how the game goes. Then we move to another person. The role of the moderator will be on assigning the task and seeing where the participants are guiding their ideas. If the participant say a barrier instead of facilitator, so this will be allocated by the team and then be adjusted accordingly. For the rest of the game, if it reaches at the point where you reach at this C, means you have to come back. For example, if the first participant has chosen number 3, it means he had to go back and we count from the number that they have chosen before. So if he had chosen 1, then we go from this side, we start by 1, then the person who had chosen 1 will go for personal facilitators. This is how the game is played, and it's played until each part has the main information that are needed for implementing the behavior change. So after this game, there is a note taker who is taking all the content that are being presented. Then he will analyze them, use them for making a story that can be used for behavior change. As Devie, when you use this tool, we were able to make 3 comics. One of them, we called it If You Knew. It's a story that we will encourage all youth and the parents to read. It includes a story of a boy who were jailed because he didn't discuss with their parents about sexual education. And the insight from that story were again through the discussion that we read with parents and kids using this pathway to change game.